video is going to be for basically a give and take for more complex movement patterns. So something with a rotation, a twist, combined with, in this case, flexion. So hip flexion, lumbar flexion, those are key elements to a more flexion-based activity. Of course, if you're bearing weight, you want to have the knees be able to bend into the ankles as well. We want to try to limit the thoracic flexion there as well, because that typically becomes dominant, especially when the posture is not the greatest, or when there's weakness throughout the whole system there. So first we're going to basically take a TheraBand here. A heavier one is best for this situation unless you really can't tolerate it. But I'm going to tie a double knot in it. I'm going to shut it in the hinge of a door, which I don't have here. I just tied it to this post here, but most people don't have this. So tie a double knot, put it on the inside of the hinge, make sure the door opens away from you, so that way when you pull on the band, it makes the door even, keep it tight and closed so it doesn't open when you release the band. I'm going to start on the bottom hinge, and I'm in a chair here, a fairly sturdy chair. Now I may need to adjust the distance or the angle depending on how that feels, but I want to make sure that I'm actually working the muscles on this side in the rear. And rotationally, I'm going to be using one set of my obliques on the sides here. So there's an external and internal. I'm going to use one of each as I twist this way, and then when I go the other way, I'm going to use the opposite pair. Okay. So I want to stay tall through this upper chest. I'm going to hinge forward from my hips a little bit. So I want to think about, I'm going to really come down across this far side here towards that door. That's the one that I really want to challenge. That's where I have maybe my difficulty. So I'm going to take up as much slack as I can. I don't want to go to the point of pain here if it is painful. And I'm going to just get as far as I can without the pain, without collapsing too much. Keep that back kind of neutral with a twist. And then I'm going to pull against. So it doesn't matter too much how far you're going here. You just want to make sure you can feel the connection in the movement. As I lift and twist, I'm extending and twisting out of that flex position, and then letting the band pull me into flexion and I have to control it so I don't go into pain, okay? So I'm trying to train those muscles that might be tight and overworked to let go a little bit, to loosen up, eccentric release, to train them so that when I engage the other muscles coming this way, they can allow the movement without jamming things up or causing compensation that's somewhere else. All right, so then I've already got it preset, so I'm going to come over to the other side. Now what you'll have to do, because we ultimately want to move in the same direction, is I'm going to have to turn this chair around. Okay, and now I'm in the top hinge, okay? Again, I have to maybe adjust the chair. And I want to have the arms kind of straight, especially this one. I want to have that leverage. Now if that's too painful again, shorten them up, keep it tight. Try not to get too much play and movement through your arms. Try to get the motion from your trunk. And now I'm working the opposite pair of obliques here and some other muscles to guide that rotation and flexion. So a little bit of abdominals to pull down into flexion here too as I work against those tight back muscles. But you probably want to do the first one first because you want to get some slack there. You want to loosen up, train those muscles to let go a little bit to make this one a little less painful and a little smoother, and hopefully better when you go to retest that. This could also be done in standing if you feel comfortable to do that. You could do both of those in a standing rather than seated position, especially if that's when you get your pain, or you could progress to that. So it's basically the same thing, but just in a squat position, letting it pull you down, right? Versus sitting and then coming this way. Same thing. You're pulling down into that chop position, squat.